Imagine a person with end-stage kidney disease. It's a difficult situation. What is going to be the outcome? There are three outcomes for this person. First outcome is the grave one, it's death. If this person lived 100 years ago, 100% would be dead. Second outcome is dialysis. Since, I would say, 70 years ago till today, we have the possibility to dialyze the patients with end-stage kidney disease. It means 3 days per week and 4 hours each time the person should be connected to the machine to clean the blood. But the third option in here is transplantation. Now we have the chance to transplant organs. Madam Toastmaster, fellow members, honored guests. We are living in transplantation era. Now we can transplant heart, lung, liver, kidney and pancreas, even cornea, bone and skin, and even heart valves. But there is a concern in here. After an increase in the number of transplantations during the 80s, 90s, and even till the middle of this decade, we see some plateau in the number of transplantations. And the reason is we have organ shortage. Now every 3 days, one person in our own Ontario dies while on waiting list to get one of the organs. So we need more organs, it's clear. Maybe you say, okay, we make a factory, we create more organs. But based on today's knowledge, the organs just come from the people. We cannot make them. There are two types of organ donors. First type are living donors. The living donors are the real Samaritans, fantastic people. They have altruistic thoughts, and it makes them to donate half of their lung, for example, or half of their liver, or one of their kidneys. The second type of the donors is we call deceased donor. It means we donate our organs after we are dead. Some people may think most of the people are not eligible to donate organs, but reality is 75% of the people are eligible to donate one or a few of their organs. The oldest Canadian organ donor was 90 years old, and the oldest Canadian tissue donor was 102 years old. Is strange. But you may ask, okay, we want to, for example, donate our organs. What we can do, how the system works. In Ontario, we have an organization, it's called Trillium Gift of Life Network. They basically regulate the organ donation and organ allocation in Ontario. If you ask them to, for example, register with organ donation, you will get a brochure like this. It comes like this. Some information, and there is a donor card. In this process, you need to go through 2 steps. First step is to sign the donor card. You sign the card and you keep it with yourself, your wallet. And the second process is to talk to your family, to your next of kin. The reason is, if you don't talk to your family and something happens, and for example, they find this card in my pocket, and they call to my family and ask them about the donation and this process. And my family says, for example, we are not sure, we never talked about it. In this case, the surgery team cannot continue. They need some sort of clear agreement between the member and the family or next of kin. There are some alternatives to signing the donor card. At the time when you change your driving license, they ask you, but sometimes they don't. They put, actually I recently signed my donor card, they put a mark in here, back of the card, or in your health card, again, the same story. They ask you, they put a cross, a mark, in the back of your health card. Transplantation is the optimum treatment for most of the organ failures. By every transplantation, each person, by signing the donor card, can save up to 8 people and can have positive impact on at least 75 people around those people. There is a sentence on most of the, I would say, advertisement or the people who promote organ donation. Do not take your organs to the heaven. Heaven knows that many people need them here. Madam Toastmaster.